I want to welcome everybody as well. And just a couple other points on last week's conference. It was the first conference ever on family violence in Minnesota. And we had 4 nationally known speakers on it. It's all going to be in the website. There's 2 of them we have a video of, and the others we have presentations. Really worth looking at. And I will be putting out materials for the next few weeks in terms of our webinars and also our weekly blog, just to kind of summarize some of the things. But I learned a ton about family violence, which is basically the concept that if one person in the family, including pets, is getting harmed, other people are almost certainly being harmed as well. So we need to look at family violence from a holistic point of view. So I'm going to introduce our guest today, Mary Pat Lee from the Greater Minneapolis Crisis Nursery in a moment, but I'd like to give you a little heads up about our next webinar, as I usually do. There's, as you know, every 2 weeks at 2:30. And the next time we're going to welcome a person named Dee Wilson, who is an expert in a number of topics related to child protection, including the chronic maltreatment of children, which is an under-recognized phenomenon, and also child torture, which is a fairly grim but very important topic. And Dee had 25 years as a direct services worker in Washington State, and then worked his way up to management roles. And then he directed training at the School of Social Work at the University of Washington. But then most interesting, at least to me, is that he had a stint as a high-level executive with the Casey Family Programs in Seattle. And as many of you know, if you've tracked this, we have been a frequent critic of Casey Family Programs because of this foundation's advocacy for practices that we think put children in danger and cause them psychological harm, such as interviewing children in front of the adults in the household, which is definitely going to put a crimp on what they're likely to say, and also giving people 3, 4, 5 days advance notice before that initial child protection visit. So it's sort of a wink, wink, nod, nod. Hey, you better get ready. Child protection's coming. You know what to do, kind of a thing. So there's those and a number of other practices that they have promoted heavily across the country that we have some problems with. But now, and then he did some consulting and training, but right now he is going to talk with us, and he does also a monthly blog called The Sounding Board, if you want to look that up. So he is a pretty well-known and well-informed contrarian. So that always makes for an interesting event. So that's 2 weeks from now. So I want to introduce Mary Pat Lee. She and I have known each other for what, 30 some years at least. Yeah. And she is the longtime executive director of the Greater Minneapolis Crisis Nursery. And which has been around for what, 40 years, I believe. And prior to that, Mary Pat, prior to her being there, Mary Pat worked a lot in development, including as the director of development and communications for Habitat for Humanities in the Twin Cities. She also spent a number of years in Washington as the director of major gifts at the Center for Community Change in Washington, which is an old-timey community organizing organization, am I right? And just recognize it from the old, going back to the civil rights days, so it's a venerable institution. And then I think you also worked in development at St. Kate's, if I remember correctly. So I don't know, Mary Pat, if you want to add anything to that, but we want to interview you today. That's our format for today. And then we'll have plenty of time for Q&A after the end of the interview, but we want to interview you about that. So is there anything in your bio that I missed that we should know about?
Nope, I think you covered it. I thank you for not calling me a contrarian.
No risk of that. Yeah, but you do great work with the Crisis Nursery, really important work. So what I wanted to ask you first is just give us the basics. How long has the Crisis Nursery been around? And, basically what do you do? Starting, I think, with your respite care, which is what most people would be.
Sure. Well, you're absolutely spot on about our founding. We will be celebrating our 40th anniversary in April. The nursery was opened in April of 1983, and it was a byproduct of a study that was commissioned by United Way to Minneapolis United Way in those days to look at child abuse and neglect and what the resources in our community were. And one of the gaps they found was that parents who had need of addressing some kind of emergency didn't have a place to and didn't have anyone to watch their children, didn't have a place to bring them. And so that created the Child Abuse Protection Task Force. It was chaired by Lisa Taylor, who went on to become the founding board chair of the Minneapolis Crisis Nursery, and is still involved with the nursery today as an emeritus board member. So we feel fortunate. Sometimes I find myself thinking, as I reflect on our mission, which is to prevent child abuse and neglect and create strong, healthy families, that it would be lovely to say to you today, yes, we're 40 years old and we got this problem licked, so we're going to go away. But that is not, unfortunately, not the case. But our program, initially when they started, it was really about just providing overnight care for children. It started out in the Holy Rosary Convent in the Phillips neighborhood. And there was a robust group of junior league volunteers who diligently scrubbed and painted and solicited things that they thought would be helpful to have in a nursery. They were at that time planning to have up to six children a night, and they opened their doors and nobody came. And actually it was, I believe, a couple of months before a parent actually came with children to place at the nursery. And I think that is one of the really important lessons that we at the nursery carry with us. And that is that the client for us is the family. And our success with the family is really rooted in the kind of relationship that we can engage and create with them. So we have what we kind of think of as a continuum of care for our services. We have a crisis line. You can call the nursery any time of the day or night, any day of the year, and we will put you in touch with a qualified family advocate who will talk with you, or more importantly, listen to you about what's going on and what you need as a parent or guardian. Sometimes it's just a mom with a colicky baby who hasn't slept in a couple of days and needs to know that it's okay to step away and that it's okay to call, identify perhaps some folks that that mom knows that might be interested in coming over and providing some support to her. Other times they can be more challenging calls. Someone who's in a domestic violence situation, someone who's experiencing mental health challenges and not sure what to do about it. Someone who's about to be homeless and needs to go find a place for she and her children, it's usually a she, to live, but doesn't have the capacity to do that while also caring for their children. And so with that call, we start the engagement or the relationship with that parent. If we find that they do need to use our respite care services, we will arrange for them, if they don't have transportation, to come to the nursery. Their children, newborn to age 6, can stay with us up to 3 days at a time, up to 30 days in a year. A parent that uses our respite care services a second time, we'll start to talk with them about the possibility of participating in our home visiting program. That's a program where master level clinician will come to their home and work with them on what is it that's keeping them in crisis. But even more importantly, work with them on the parent-child relationship. So many of our parents experienced out-of-home placement as children, and they don't have a really good model for parenting. The fact that they're reaching out to us tells us, we're a voluntary program, tells us that their they're trying to do what's best for their children, and we want to partner and support them in that. We're a strengths-based program. That's our approach. So from the very start of our relationship, we're telling that parent, wow, asking for help is one of the hardest things you can do. You are doing a great job, and continue to try and work with that parent to build their sense of self-esteem and their sense of confidence in themselves as a parent. Obviously, in our home visiting program, which can last with a family for up to 2 years, we have a better opportunity to work with that parent to get to a place where they really feel like they're able to meet their family's needs, and they understand what their child needs from them. We also have in-home mental health services that we can make available to families that want to participate in that program. Not surprisingly, depression and PTSD are pretty common mental health ailments that folks that we're working with experience. I should say that while our services are available to anyone in Hennepin County, the vast majority of our families living on incomes of $10,000 a year or less, I think about 90% of our families live in that income range. They're also overwhelmingly people of color. So folks that have really experienced severe poverty and all the challenges and life experiences that come with that, parenting in that environment is really, really difficult. So that kind of in the Reader's Digest version is how I would describe our services. Excuse me.
Mary Pat, when we were getting ready for this little event, you talked about what your home services are like, and I thought the kinds of things that, I mean, there's a lot of home services around of one sort or another, but can you tell us a little bit more about what that involves? Because I think it's a really interesting approach and one that, has the best chance of success from some of the work that I've done. And I'll talk about that a little more later. But so how does that work, the in-home services?
Well, first of all, it's in-home, which is great because it doesn't require the parent having to get anywhere. It also gives the home visitor an opportunity to kind of see the environment the parent's in, to see the parent interacting with their child so that they can work on building their parenting skills and giving them more tools and resources. But it's really an individualized program. It kind of depends on what does that parent need. Sometimes it's a parent who is eligible for SSI but doesn't even know how to begin to fill out an application, or a parent that would love to have their child in Head Start but doesn't know how to make that happen. Other times it's a parent who would like to be in a training program for work or finding housing, but again, needs support in making that happen. And I would say for a lot of our parents, when we first engage with them, they're not feeling very positively about their own abilities. So just really being affirming of them in what it is they need and what they can accomplish, and walking with them in that journey, whether it's learning how to ride the bus or, yeah, I can do that, I think. How's that? Or making calls to resources that they haven't been able to access because it's just feeling too overwhelming for them. So the home visiting program is really tailored to what does that parent need, and creating goals that become mile markers for how they're progressing and getting to where they ultimately want to be as a parent. Is the best way I would describe it. It's what's wonderful about it is it's meeting them where they are and helping them identify what it is they need, and then working with them to get to that place.
Right, and the reason I picked up on that, as I shared with you, Mary Pat, is in part of my, work. For a number of years, I did best practices searches for clients in a number of fields, including employment, healthcare, and child welfare. And what I found is that the most successful programs were doing something very similar to what you're doing, which is to figure out what the actual, needs were, practical needs that people had, or what skills that they wanted to develop and needed to develop in order to become more independent. Start where they are, not where you think they should be, and then set little stretch goals, things that they could accomplish, but are going to actually stretch and build their skills, not some goal that is way beyond their reach. And those have been, in a number of areas, I think, successful. So I was really encouraged to hear you talk about how you do that particular part of your work. So just to recap, basically, you're not just the respite care, you're the in-home services, you're the 24-hour crisis hotline, and the mental health in-home services as well. So much more, I think, comprehensive kind of approach than people may realize. And along with that, I think you have a comprehensive approach to how your staff work with people. You call it Nursery Way, if I'm correct on that. And that is equally fascinating. So I wonder if you could share what Nursery Way is.
I would love that opportunity. I'm sure that some of you are familiar with Ann Garrity at the School of Social Work. And a number of years ago, when we were doing a strategic planning process, we did an environmental scan to assess, public sector folks, higher ed, nonprofit community. Did they know about us? What did they think of us? And one of the people that was interviewed was Ann. And she was relatively complimentary, but at the end of her interview, she said, they can do more in 3 days than they think. So after we finished the plan, a colleague and I went to go visit Dr. Garrity, and I refer to it as our bring it on sister conversation. If you think we can do more, tell us, share that with us. We want to do that if there's more we can be doing for children. And that was really the conversation that gave birth to the concept of the Nursery Way. And the Nursery Way is really an approach, protocols that we use here to try and ensure that we recognize that every parent and child that enters our doors experienced crisis or trauma, and we know there are things that we can do to support people that have experienced crisis and trauma, adults and children, that can help reduce their stress and improve their social and emotional well-being. And so we worked with Dr. Garrity to develop the trainings, and then we trained everyone in the building. A lot of times there's a lot of opportunities to go learn about trauma, but the challenge is people go to a training and they're really jazzed, and then they come back and nobody else has had the training. And so we all default back into the way we always do things. In this situation, what we said is, no, everybody is going to learn this because everybody has some kind of interaction with a parent or child here in the building. I mean, we train our childcare staff, but guess who interacts with the kids a lot too? The receptionist or the guy that works in the kitchen. So we really made a commitment to trying to make Nursery Way our culture. And it's a culture that fundamentally says, when a kid is showing up perhaps not as their best self, we don't ask what's wrong with that kid. We ask what happened to that kid and what do they need to try and address that concern. And so it's about creating stability, predictability, letting kids and parents know they can expect help here. We're very intentional in terms of the schedule the kids have, the language that we use. We try and ensure that kids have a positive interaction with adults. Dr. Garrity reminded us frequently that kids have an amazing, especially kids not 1 to 6 or 0, well, primarily 3 to 6 age range, their capacity to associate. And the example she gave is a kid who has a volunteer or a teacher, that's what we call our childcare staff, who says to a child, here, let me help you tie your shoe, or let me help you cut up your food, or whatever it is that they're going to try and help them with. Most of our kids, the primary adult in their lives He's their parent or guardian. And because they tend to live lives that are very not stable, they're moving around a lot. They don't get to know a lot of other adults. And in some cases, the adults they do know, they don't want to have interactions with. So our goal is to create a positive experience with an adult. And the way Dr. Garrity describes it is, so at the nursery, you offer to help kids. They get to preschool or kindergarten, and a teacher or aide comes up to them and says, "Let me help you," instead of freaking out because no one's ever said that to them. They don't know what help means. They go, "Oh, I remember a place where adults helped kids, and this must be that kind of place." So it's really trying to help shift, if you will, the lens and the experience of the children, help them reduce their sense of stress. The other thing that we try and work with staff to understand is, even that if that child looks like everything is okay, these are kids who are always waiting for the next bad thing to happen. So they're kind of in that fight flight mode, and cortisol levels can be high even if they look like they're having a good time. So our goal is to really help them experience respite and try and teach them things that can help them with the big behaviors they have. We do a lot with stress reduction techniques that are rooted in mindfulness. We actually did an assessment with, we look at groups of kids at the nursery, and we actually did an assessment where staff were trained in those stress reduction techniques, and used them for several months with the children, and then had the assessor come back in and look, and two of the positive behaviors that we were trying to instill or promote within the children improved after we started those techniques. So it's really about trying to use the opportunity we have with the children to both understand things that help them address stress and crisis in their life, and then also share those tools with a parent, help that parent understand what that child needs in ways that are respectful and encouraging, not judgmental, which is easy to fall in to do with some of our parents. So trying to give kids an opportunity to have choices. We have a fabulous clothes closet here. And one of the things you get to do if you're old enough is pick out what you want to wear at the nursery. As long as it's safe, we are fine. And what you want to eat, you don't get a second dessert. But other than that, if you want more food, or if you don't want to eat some of it, we're not going to pick a food fight with you. We want you to feel like you can have some choice in what's happening in your life. And a lot of our kids don't feel like, they feel like life is happening to them. I could go on forever on the nursery way. So
I think, there we go. You talk about mindfulness and stress reduction techniques. Can you give us a couple examples? I picture, a room full of 4-year-olds meditating. So what is that part of it?
No. It would be glitter jars. It would be belly breaths. It would be blowing cotton balls. That would be using the tuning fork. Who hears this? And just things that, sometimes talking about chewing their food, how they chew their food. It depends on the age of their children, but just things that kind of help them focus, and in focusing to kind of release some of the energy or focus that isn't helpful to them at that time.
And you mentioned in some of the development of this approach that you worked with the Harvard Center for the Developing Child, and also Megan Gunner, who many people may know is the lead person at the Institute of Child Development at the University of Minnesota, internationally recognized institution. So what were the role of those kind of big name folks in developing this approach?
Well, about 2 years after we started doing the nursery way, maybe 3, we pulled together a meeting with certain folks in the community from the foundation and academic world. Dr. Gunnar was one of the people we invited. And she was she was very excited because it turned out most of the research we were using as a basis for the practices and protocols that we were implementing was her research. And she began to work with us on refining and adding tools. The whole notion of doing assessments, she lent us one of her doctoral students who actually, children are only here for 3 days at a time, up to 30 days a year. So you really couldn't do individual assessments to try and see what was helpful to kids. But Carrie was able to figure out a way for doing groups of children and identifying what behaviors we wanted to watch for, and just a system for measuring that we would never have been able to develop on our own. And as a consequence of this, we've been working to not only use the nursery way here, but looking for opportunities to work with other organizations that serve a similar population. We don't think that serving families in extreme poverty is something unique to the nursery. And we think that by partnering with some of those other agencies, we can help more families benefit from the nursery way practices. So we've actually exported the nursery way and worked with Jeremiah, who trained on both of their campuses, women's advocates in St. Paul, first domestic violence shelter in the country, actually, has also had staff trained. We're now working with Dr. Gunner to partner with 2 agencies, and we think we have the 2 agencies committed now, to do an assessment that would allow us to determine if we can collect data that demonstrates that, yes, using the nursery way practices and protocols really does help children improve behaviors. We think if we're able to do that, there'll be a much greater incentive for funders, public and private, to start supporting other organizations that are interested in benefiting from that kind of training and practice. I think the 2 organizations that we're going to be working with on the study are able to do it because we secured a funder who was willing to do that. The agencies that would most benefit are unquestionably organizations that are working with really folks in really tough economic situations, and the organizations themselves are challenged to come up with funding. So we're really hoping that we can make a difference in the financial support for organizations so that they can also use these practices and have families and kids that benefit from them.
So great. So develop the nursery way and then share it with others so they do it as well, able to do it as well. Now,
absolutely.
I don't want to put you on the spot because we haven't talked about this yet, but as you may recall, I've worked mostly with older kids, teens who are on the street and kids in crisis. And so I have an idea of, what kind of things you try to do if a young person who's in, just in crisis and a really bad spot just kind of loses it. But I don't know what can you give us some concrete ideas of what you would do if a child, just started behaving in a disruptive way and a lot of other kids around and maybe are, intimidated by that, or, how do you just calm those situations down?
Obviously the goal is to really, and if need be, to go into one-on-one. And we have kids, I have watched staff, particularly when a child is coming for the first or second time, just go into one-on-one with a kid who's having big feelings, and having that child in a place where they're safe and where the staff person can sit with them and just kind of being present for them as they deal with their emotions. And more often than not, sometimes it takes what seems like a really long time. The child calms down and is able to engage. But I think what what we've seen here, a lot of the families that use our services don't just come once. And so the benefit of our practice and the opportunity to interact with children and parents over a longer period of time is that the staff learn things about the child that help them help that kid move beyond that really stressful big behavior kind of experience. And the best example I can give you is a little boy who used to, when this kid started coming to the nursery, everybody in the building knew he was in the building because he would just be so distraught. And again, it was one of those kids who, you know, the teacher would sit there just being there. And over time, they learned things about that kid through, like they created a game. They learned that he liked superheroes. And so they had the superhero award. And oh man, this kid really wanted to be a superhero. And so they would do things that would allow him to earn that super award. And just over time, I remember walking down the hall one day, and he was in a classroom with a teacher, and I had no idea he was even in the building, and he was being the teacher's helper. I think the children learn a different way of behaving and a different way of interacting with the teacher and the other children because of the support that they're getting.
So that makes sense. So it sounds like when necessary, you can give children some one-on-one attention. And kind of, you know, I'm always curious about staffing. How many staff do you have, and where do you get the funding to make sure you have enough people to actually pull this off?
That's a really good question, Rich. When we're fully staffed, we have about 48 FTEs. But the reality is we have about 70 people on payroll because we're 24/7. So we have lots of, full shifts, but we also have part-time shifts and weekend shifts. Our budget this year is about $3.8 million. 700,000 of that will come from the county, but the vast majority of it, and it's somewhat unusual for a human service organization, but the vast majority of our funding is philanthropic. So we're working with individuals and corporations and foundations to try and garner support and to do it for general operations as much as possible, because our greatest expense are the staff that we have. We staff at a 4-to-1 ratio, one teacher for every 4 children. And that's certainly better than a lot of daycares. But if you have 4 toddlers, that's a lot of kids. So we also try and supplement that with volunteers. And fortunately, everything's been a little off during the pandemic, but fortunately we have a really great pool of volunteers that are wonderfully supportive and great with kids who are willing to come in and help our teachers.
I think anybody who's been in this world for any length of time knows that to keep an organization with almost 50 FTEs going for 40 years without most of the money come from the government, but it, is really a remarkable achievement itself. And probably the fact that you have such a strong development background is, a major reason for that, since you've been there for quite a while. But that's really, it's not usual to be able to carry on that long, mostly on philanthropic dollars. So,
well, we have been really fortunate to have people supporting us that have a commitment to the families that we work with, and we're really, really grateful for that. And we just need the opportunity to tell more folks about the needs in our community and give them the opportunity to partner with us and support them. So,
yes. Well, anyway, congratulations for keeping things afloat that long. So I appreciate it, Mary Pat, and I'd like to open it up for questions or comments or points of view that people may have. Please Feel free to turn your camera on if you want to, so we can see you when you ask a question, or not, and or put something in the chat box.
That's a really good question.
Did everybody see that question, or maybe you could just repeat it?
Oh, sure. The question is, how do you work with other agencies and or child protection? We've done work with people serving people in the past and doing parent ed, and obviously our nursery way exporting work is involving other agencies. The county, one of the things I'm really excited about with Hennepin County is the work that they're doing around child well-being. And we are very interested in seeing how we might be able to support those efforts. Child protection is a little more challenging for us just because we have it, well, certainly we have families that have open cases. And at one time the county was wondering if we might be able to provide 72-hour holds. The concern for us is that trust with families is so important to our ability to do our work, and the concern that knowing that other people's children were, or that children who had been removed might make families less willing to trust us, and so. But we're certainly interested in working with the child well-being efforts. Have had conversations with Commissioner Conley about that. We also have a grant from Hennepin County for home visiting, and they make referrals to us as well. So we're a little more in the prevention work. So anything we can be doing with the county that would support that, we're eager to be their partner in. The next question is, does your group pay attention to parental literacy skills? Certainly, if we're working with a parent and we're seeing that literacy, anything that the parent is considering to be an obstacle, we're going to work with them on. We've focused more on literacy in children. We do a lot with books here. And I guess try and promote from that 2-gen approach, but probably not as much work in that area as we should. We don't, and the next question is, do you have translators or interpreters? We don't, but we have a service we can access if we need that, and have done that in the past.
So what if someone doesn't live in the Minneapolis side of the river? Are there other resources for people?
Well, anyone can use our home or our crisis line. So that's not unique to Hennepin County. We've provided home visiting services to folks that have moved outside the county. Interestingly, our 2 partner agencies that we're going to be working with on Nursery Way are actually East Metro nonprofits. And there are other crisis nurseries. We are one of only 2 residential facilities in the state. The other is in New Ulm, and we help support them in their development. But Lutheran Social Services operates a couple of crisis nurseries in Greater Minnesota. And then there are counties, Family First, it's obviously not a county, but Family First supports a number of crisis nursery initiatives in other parts of the state.
So if I'm a parent and I'm in a crisis situation and I'm in, I don't know, Woodbury or St. Paul or someplace like that, I can call the crisis line, but where would I go is there a place where you can get respite care? Is the big service you might need?
There's not a respite care program currently, and Ramsey County.
Right.
There was, but unfortunately they had to stop providing that service.
I've got a comment and then a question.
Sure.
Mary Pat, I don't know if our paths ever crossed, but I worked with Hennepin County Child Protection for 37 years and used to supervise at one point in time our 24-hour emergency team and so forth. So I'm very familiar with Crisis Nursery. As a matter of fact, I used to do some of the in-service training for mandated reporting for
Sure.
Crisis Nursery staff.
Thank
And
you.
so the comment part of this is that in walking that fine line between, building trust with the people that go to Crisis Nursery and every staff member at Crisis Nursery being a mandated reporter, I always found the people at Crisis Nursery to be very good to work with. And we had a very good partnership in terms of walking that thin line so that we could do our jobs and the Crisis Nursery people could do their jobs. The question I have is that back in my day anyway, as part of that, I didn't know what the budget number was, but you said $700,000 with the county, is that Crisis Nursery always had a couple of beds that were reserved for the Hennepin County crisis people, so that if we were dealing with an emergency situation, that we had a resource for those situations where a 72-hour hold was not appropriate, and we certainly didn't want to take a more aggressive, assertive child protection approach, but we wanted to offer some respite for the parent, typically a mother. Does the county still pay for those emergency beds?
That relationship kind of evolved over time.
Yep.
And I think what happened was they weren't using the beds a lot. So we would call when we had what we thought were emergency bed needs or crisis, actual crises. And then we got to a place where they said, you should just go ahead and use the beds if you need them. So we do reserve beds for crises. And obviously if the county called and they were available, they would be available to the county, but they're not reserved. And that actually allows us to serve a broader array of people, if that makes sense.
Yeah. Yeah, that was always kind of a negotiated relationship about the use of those beds from kind of like from year to year or whatever. Yeah.
Yeah. The county's been a great partner. And as you pointed out, we are very clear with parents that we are mandated reporters and we will call. And we call a lot. We'll call just to check and see if it's something that the county thinks should be looked into. So we tend to err on the side of being cautious. I'm always reminded of the story of the mom who brought an infant to the nursery, and as the child care staff was giving it an intake bath, noticed burn marks on the baby. Mm-hmm. And so child protection was called and came in, and it turned out it was mom's boyfriend. But she was afraid to call because of what he might do to her. So she brought him to the nursery knowing we would. And I always thought that was a great example of a mom reaching out and using what she can to meet her child's needs.
Yeah.
I really appreciate this part of the conversation because we struggle with it too. It just, you're trying to maintain trust with the parents, but you also have a role in preventing abuse. And I don't know if I mentioned this, Mary Pat, but we're nearing the end of a year-long study in child fatalities from maltreatment. And one of the things that we've discovered, and we'll be putting out a report in a month or so, and one of the things we discovered is that many times mandated reporters, particularly medical providers, see child abuse, let's say a bruise or a burn on an infant. Well, infants can't bruise or burn themselves because they're not walking yet, right? And they either miss it or they dismiss it for whatever reason and don't report it. So it's always just, there's reasons they don't want to lose a relationship with the client. they don't really have much confidence that child protection will do a good job, whatever the reason is. But it's such a tricky area. And, if there's anything more that you and Greg, who's, a retired child protection supervisor, want to add to that, it'd be anything more to say about that, that would be, interesting to hear and useful.
Yeah, I think I have always been someone who said that there is a role for child protection. And just as I wish the nursery could go out of business, I wish we would never have to fear that bad things would happen to children. That's not the world we live in. I think many of the families that we're working with are families that are probably more likely to be at risk of neglect than abuse. But certainly there are parents who have used our services who have engaged in practices that were injurious to the child, and we've called those in. So
there's a couple of questions from Mark that you might want to touch. One is about matching people culturally between the in-service folks and the clients, and then something else about drugs. I didn't quite get the whole thing. You see that?
Yep. The first one is for home visitors program. Do you match the cultural racial identity to the client? I wish we could, not currently, because I would say the vast majority of our clients are African American, and we do not have currently any African Americans working in our home visiting program. It's not a large program in terms of staff, but we have a new director of program who is amazing, and a woman of color who has a lot of networks here in the community. And we are hopeful that under that kind of leadership, we'll be able to recruit more. It's just a bad time to be hiring, period, here in this day and age. We're hoping that changes, but we would welcome the opportunity to be able to provide culturally fit staff for families. Your other question, Mark, is how frequently are illegal drug use complicating the lives of the families they see? I would say the biggest drivers for the families that reach out to us tend to be homelessness or the risk of homelessness, domestic violence, mental health of the child or parent, physical health of the child or parent. There may be drug use in the home, and we have had instances of that. It isn't necessarily the parent that is the abuser, but certainly the kids that come here are exposed to it. And it's, again, one of those traumatic experiences that we want to be acknowledging and recognizing the behaviors that we may be seeing are an outcome of that.
Do you think perhaps half or more families would you say perhaps half or more of the families that you see might have some drug use at home?
I can't attach a number to that. I can tell you that I think these children live in communities where one way or another they're exposed to it.
One of my earlier questions.
If I could comment a little bit just from a broader context of child protection as a whole, and I would broaden the issue, Mark, beyond just illegal drug use, but to include alcohol abuse.
Sure. Yeah.
Because alcohol abuse, while legal,
right,
is a real problem.
Correct.
And when we would do statistics, at least during the time that I was working in child protection, chemical use, including alcohol and illegal drugs, as a primary condition in the report, or as a secondary condition, which we would sometimes encounter as we were doing our investigation, there was a correlation, and the numbers usually ran between 70 to 75% of the time that some form of drug use, legal or illegal, was a factor, either primary or secondary, in about 70 to 75% of the cases.
I asked earlier about literacy issues, and I've been paying attention to this.
We're having a little bit of a hard time hearing you, Mark. Can you get closer to your microphone, or?
Is this working better?
Yes.
Not a little bit, not a lot.
I've been interested in literacy issues, and the first 3 years is key in child success in school and literacy learning. And it's often multi-generational, and therefore, when you link it to 60–80% of prison inmates are poorly literate, there's a connection here. And so if I were still in practice, I would use the maternal literacy skills as one of my measurements in my vital signs in my clinic. I didn't know that at the time. Do you pay attention to parental literacy skills as an important marker or an ACE for that child's future?
I think we promote reading. We send children home with books. We at one time were working with a nonprofit, Bring Me a Book, that provided books for children that came to the nursery. I think that we encourage parents to read to their children, but we don't do any measurements around that. And again, it really depends on what's going on in the home. If a parent is living in an unstable environment, it's harder to focus on things like literacy. You need to have a bit of stability, I think, before you can work with them on those. And I know really important, that kind of important work.
You answered my question.
Thanks for asking it.
So Mary Pat, I think you kind of covered this, and I wasn't quite grasping it, but do you do some kind of any kind of developmental assessment of children, let's say 3-year-old, where the kinds of things a 3-year-old should have at that stage of the game, but to see whether they do, or by whatever the age?
We do that in the home visiting, and that helps to frame some of the goals that the parent and has with the home visitor.
Okay. There's one other question. Was it? Yeah.
To most of the family.
Yeah.
Sometimes it's a one and done. That might mean that they've moved out of the area. I would say a parent who's using us because they're having a baby and they don't have anyone to watch their other children is probably one of the likely areas that a parent would use us once. I've often said if whatever's challenging these families could be dealt with in one visit to the nursery, you wouldn't need an almost $4 million program to address it. Families are looking for support and assistance in dealing with really challenging lives. So yes, it's not at all uncommon for a family to use us more than once. And that's actually a good thing. That's how we build that relationship.
And I think you had said 3 days at a time, but 30 days in a year. So that suggests that there's sometimes at least,
And the reality is, safety is one of our top values. The well-being of children comes first. And while we say 3 days at a time, there are circumstances that warrant extending that because something's going on in that home that just would not make it a safe place for that child to go back. Maybe a mom who's got severe postpartum depression and just needs a little more time. Rules are obeyed. We use rules at the nursery to help families, not to enforce rules. So we try and be flexible.
Okay, I think we have time for maybe 1 or 2 more questions. One probably, and then a wrap up from you, Mary Pat. So
there's a question about the curriculum for home visiting, I think is what, and we're using parents as teachers.
Okay.
Because that is evidence-based, and we don't start working with people until they have children. So the programs that in order to meet their evidence-based practice, require prenatal. We don't do that, obviously. So, but PAT's been great.
So can you give a thumbnail description of what PAT is? Because
It's parents as teachers, and it's really working with the parent to promote their ability to parent and engage with their child. It's really about building that parent-child relationship.
yeah, and skill set, which I think this
Skill set.
gets to, Mark, what you're always interested in, which is literacy, because I think to the extent that those skills that are being developed through parents and teachers, that may not build literacy per se, but it builds the kind of skills that you're wanting to, to promote with parents so that they can help their children developmentally. So I think that's, I have read up on parents as teachers, and I think that's great. I'm glad that that question was asked, because I didn't think of it. So that's great.
I was asking just because I'm a community health worker. So I will be doing home visiting actually coming soon, but my curriculum is actually GGK, which is how you did say, Mary Pat, it's more focused with prenatal also. But I think I really love, I'm gonna be actually looking into parents as teachers, just because I really love how you stated, like how you said GGK does that, but I feel like it doesn't have like trauma based, I guess, if you want to say, as much as how you said, as that what you were stating. I really believe like ACEs, we should be using ACEs a lot, especially in schools.
Yeah.
I personally, learning about ACEs, it shook me because I found that out in my 20s. And it's really unfortunate because how I said, I ended up finding out that my ACEs were super high. And how I said, I know kids now, they're going to school and they're walking with ACEs, they have all these traumas, and we don't know how much the teachers are triggering them or kids are triggering them. And definitely, how I said, I'm so passionate of bringing ACEs to schools and to parents, also letting parents know right away, like what is ACEs, because at the end of the day, maybe the parents have ACEs too, and they don't even know it.
Absolutely. And there's a the Center for the Developing Child at Harvard has a lot of resources that we've tapped into, and just some really simple videos. I think they're trying so hard at the center to help people realize that, yes, there are a lot of children and adults who've had these adverse childhood experiences, who are experiencing and responding to unaddressed trauma and crisis, but there are things we can do that mitigate or repair that if we become more informed about that.
I agree. How I said, I think it will stop a lot of drug abuse, a lot of violence, a lot of things, just because if we start at a young age, with our kids, with the kids who are going to be the future, I think it would help. And how I said, I'm definitely passionate about that. I'm working so hard to do that, especially in my community, just because in the Hispanic community, stigma with mental health is so, it's negative. It's either you're crazy, or you're weak, or just don't talk about it, do the hush hush thing.
So Anna, can you just say what that acronym stands for, the curriculum? What?
To be honest, I do not know exactly how
so
I
what
said.
was it? Was it KK something?
GGK. It's called GGK. I am gonna look it up because it's called Great Kids. So it's Growing Great Kids. Okay,
so it's a curriculum for in-home
visitors.
Okay, good. Growing Great Kids. Okay, I haven't heard of that one. That's good.
Yep, that one is how I said, it's really used. How I said, I work for the county, so that's what the ones we decided to use. But how I said, I have heard about the one that Mary Pat has mentioned, and I heard that one is really, really good too. So I think they're both great.
Great.
We just need more support for home visiting, right, Anna?
We
definitely,
yeah.
I agree, definitely, and I think it's gonna work best. And I agree with you, Mary Pat. Trust, it's a big thing in my community, and I can tell you, it's getting harder, especially with the whole immigration with the whole, racism, it's definitely getting harder for me to help, because now, as how can I tell you, we are getting more people from Guatemala, Honduras, Nicaragua, like more southern. It's less people from Mexico, right? But I've noticed that while they were traveling up here, they had really bad experience with people who are from Mexico, Mexican people, right? So when they ask me, and there's something sometimes hard for me to state what I am, because I am Mexican American. When they ask me, they're like, "Oh, are you like those Mexicans that were like so mean to us or whatever?" So it groups. So it's unfortunate how he said it's always hard how he said every time, because I always tell them, we can't judge us from one person. Like, I understand, that you had a really bad experience with one. Totally understand that. But we're not all like that. I'm like, I am here to help. Let me show you, that I'm here to help. And how he said, usually they do end up trusting me, but definitely they do put their guard up.
Yeah.
Interesting. Well, great questions, really great questions. I thank all of you for this and for attending and just making this lively, and that is great. So I think we probably need you let you go, Mary Pat, but we all appreciate so much the time and all the good work that you're doing. It's a really critical spot in the child welfare arena, and just wish we could just clone you and have you do it all over the state, but
That'd be great.
so hopefully see all of you in 2 weeks from, again, we have Dee Wilson, who is a veteran of the Casey family programs, and as I said, a bit of an interesting, controversial figure with incredible depth in his research. So it'll be an interesting conversation. So thank you all. Go ahead, Mary Pat.
Thank you. And thanks for the good work that you do at Safe Passages.
Thank you. All right, see you all in a couple weeks.
Thanks, Mary Pat.
Bye-bye.
Okay.
Bye. Bye, everyone.